So it is augmenting you and your task and your capability. It is not here to replace you. Please remember this. So physician himself plus AI plus other tech, this should be the goal, not just one thing. Because now, as it is rightly been very popularized, that AI won't replace you, but the person using AI might. So it's like that. Your efficiency has to increase and you have to evolve as per the current scenario. So what is the other tech? Does anyone have any takes? Any tech they currently use in their practice or study or anywhere? Apart from Marrow. Marrow is up. Okay. So again, this is just for you to have a look and not including brainstorming with ChatGPT and Gemini. That is the basics. So does anyone know what this is? Specifically medical students? If you are not using, you should be. So this is Lecturio. It is basically a didactic model, but it can create your personalized seminars or lectures or whatever you wish for. Okay, and it is in play. This, anyone? This is my favorite. I try to use it a lot, but it's difficult to still create scenarios. You have to create a lot. This is by Meta. It's Medical Simulators Realities. So the name is Medical Realities, but the app is from Meta itself. So it has a very good 3D interface. You need VR goggles or VR enabled on your device, where you can actually walk into an operation theater, and the way you turn your head will decide which side you go, and you will actually be operating or doing a procedure. And in it you can create your own scenarios. That engine is not that great, but still this is the way forward. This, I have given the answer, but still. So this is an excellent flashcard tool. The difference in this and other flashcard tools is, this will try and recognize which subject or which knowledge stream is deficient. Like let's say you are asked a question about a community acquired pneumonia, and you have a problem in demarcating treatment, that which medicine first, which medicine second. Then it will understand that he or the learner has the problem in demarcating choices, first kayu ne biju kayu. So the next time it asks the question, it will try and simplify that for you. So this is that AI based flashcard creation tool. And this I think everyone knows. It's not Marrow. It's a spaced repetition technique. Now anyone knows? Yes, it's Anki cards. They are excellent to learn topics which you forget very often. Okay. So spaced repetition, I think I don't need to go into neurolinguistic programming, that the moment you use your cerebral oscillations to the peak effect. The one chotu sa example I'll give you is, if you don't remember a topic, before you sleep, just try and put a chart paper on your wall and sleep after you see that, and when you wake up, just look at it first and just see what happens in the next week. Your retention will go up. It's a very simple physiological concept where your cerebral oscillations are put to use. This is what Anki does. Okay. This I think practitioners would be more well versed with. You all would be still in up to date. Up to date, by the way, I think Civil has got it now. So this is Amboss. This is the closest it came to safety and database management. Still very incomplete and raw, but still it is good enough. The main drawback here is the paucity of Asian data. They have a lot of Western data, but the Asian data is still very few. So now for your mind, something to think what is actually happening. The images I am going to show you next are not all approved, like let's say US FDA or CDSC or other approving agency. There is only one which is approved, which I put last. Again, not including brainstorming with ChatGPT and Gemini. So this is called augmented radiology. This is probably the first thing which will come to be approved and to be adapted, because it's so beautiful. Just look at this. It's a scan at a level where we may not be able to delineate any organ, and the AI itself tries and superimposes some slices and the video from other angles, and then it will try and demarcate those organs for you. So anything from detection to staging to treatment planning to even procedure planning can be very easy and streamlined. This is the FDA approved thing. Anyone knows what is NDL? DL, I think everyone will know, deep learning, but N is neonatal. So ironically, neonatal radiological imaging is the first to be FDA approved. So this is one such area where the PET has superimposed and has found out a lesion where it existed along with some structural abnormalities. This is the actual patient ka X-ray, the first one. So this is the other way where AI can help you rather than you seeing an X-ray, asking, like obviously first asking history, examining, then seeing the X-ray, seeing some other reports, then asking for a PET, patient coming the next day, getting the PET done, then comparing it, then coming to a conclusion. This can be done at one go. Okay, and the beauty is the quantification. If you can see 32%, 20%. So as we all know, fibrosis less than 50% usually prominent BVM આપણે જવા દેતા હોઈએ છે. But that if it is quantified, we know for sure. So that safety has to come in us. Okay, and this was taught in the last NB AI in healthcare seminar. I don't know how many of you have enrolled in it. So this is also beautiful. It's currently in an experimental stage. But whenever you put a scope or a viewing machine, the AI will try and point out abnormalities or deviations from normal. And this is very, very easily missed by the human eye. આ તો હાઇલાઇટ કરીને મૂક્યા છે એટલે તમને ખબર પડે છે, બાકી very easy to miss them. So this, anyone knows what this is? Line chart. So people in the West now have a lot of time to even compare AI. So this is a line chart where they have compared the completeness and the patient safety of various AI agents. And if you can see, models like Gemini 3 Pro are worse than their older ones. And models like Emboss are ruling it, literally ruling it. So to simplify it, higher the dot is, the better it is. Okay, the left side is completeness. So even if it is lower and higher, we are okay. It should not be on the left side. Okay. So this is the comparative tree of various AI agents in today's day and age till Jan 2026. So tech that I personally use, it has to be pragmatic. आप घर जाओगे तो आप क्या use करोगे? Again, not including brainstorming with ChatGPT and Gemini. Anyone knows what this is? If you see my screen time, this will be the most used app. So it is Medscape, the interaction checker. So wherever you are, in whichever stage you are, you don't need to remember all doses, and it is impossible to remember all interactions. So before writing a medicine, just open Medscape. First register yourself with your registration number, obviously, and then check interactions and dosing before prescribing. It will try and keep everything updated to 3 months durations. Every 3 months the app updated. Okay. So Medscape is the first. This, anyone knows? This is my favorite, lift read. So whenever I am in a lift, I read this. So evidence-based medicine is incomplete without actual new evidence coming in every day. So this is QX read. They have updated it just 2 months back. You can select your specialty and the top leading journals will have their own articles showed here according to your field or specialty or practice area or area of choice or whatever you select. So this is the most useful app. Every day 15 to 45 minutes will just change you in 3 months. Okay, because the thing with textbooks is the moment it is printed, it is outdated. No update comes in. So when you try to become MDs or even above that, you have to stop reading textbooks. You have to be well versed with how to analyze day-to-day evidence. Okay. This one. This, mind you, it is now valid to even quote in your primary exams. We in our critical care super specialty exams were allowed to use this app even inside. So this is such a good reference tab, very, very well updated. Every 4th day or 3rd day it keeps on updating. It is MD Galaxy. You can just fill in your favorite calculators. It has all the calculators in the world. So you can just pick the ones you like the most or you use most frequently and then keep on using it. Mind you, it is not an escape route કે આ calculator શું છે ખબર નથી તો ચાલશે. No, it is just an execution which is made easier because sometimes human error happens. You forget 1 or 2 parameters. but machines will not forget. It has simple checklists where you enter data and the result comes, and with the references which are updated. Okay? So, the image which I was trying to portray, this is what we think, right? Nahin? So, what is your role in today's day and age in a tech-driven world? First is obviously literacy. If you don't know it, you will always be afraid of it. So, I am not telling everyone go and learn Python, though it would be beautiful if you can, but still have basic AI literacy, that what is actually AI and what is its implication in making things easier. Always remember, if it is making your workflow complex, it's not for you. Develop critical evaluation of data. This is the thing which will set you apart from your peers and colleagues and from other doctors with recent data coming in. Okay? And learning never stops. The moment it stops, you are fossilized. It should never stop. And ethical integration should be a norm. You should not be like, "Ah, thoduk chalse," no. It has to be very, very stringent, and it has to be safety based. So, has anyone heard this? So, I am sure my colleague after this talk will be able to highlight more, but this is also a reality. Huh? So, don't be so engrossed in AI that it takes up more than, I would say, 0.05% of your life in terms of hours or minutes or time. And this is the latest thing which is being reported. Even psychosis is happening. Okay? So, this is something you need to be wary of. So, anyone seen this video? Not all jobs are being taken by AI. Okay? So, same is in your practice. So, human touch will always matter. And again I state it, this is probably the most important message I can convey. AI was supposed to make you free, not make you bound or busier. Okay? Now, this is what tech has helped me achieve. So, we just won it for BJMC. Any questions are always welcome. Okay, none.
Thank you very much, Dr. Parth. It was very nice to hear from you.